This is the moment where we want to reflect and hear back from the different groups, because we know that each of you has been able to attend just one. So we want to hear from the other two that you didn't have the time to, an opportunity to attend, and also because these recommendations that we have co-created will be the base of the roadmap, which of course we will develop after this event with a little bit more calm and with a little bit more time, so we can put some thoughts and some reflection together in a more narrative form. But clearly, they will be based on what you have discussed and what you have produced. And so we will hear back from, let's call them rapporteurs from each of the track. Differently from alphabetical order, we're going to start with track B. So I invite Charlotte Marchandise, she's the executive director of UFA, to present her recommendation. Charlotte, this is a microphone that should be working. Let's try.
Thank you.
Yes.
Hi again. So we had a very good workshop on One Health, and we really worked on how can we convince the President Ursula von der Leyen to implement something that is going toward action and toward knowing everything that is happening on the ground, and many things we don't know about. We had amazing examples from the healthcare sector, from the cities, from the professional like the nurses. And how can we gather all of that? How can we take them to standardization at European level, but we also saw that we have a big fragmentation level at national level, and ministries fail to really implement One Health. One of the things being that it goes to health sector, and health sector has not been known to be the more powerful ministry. So for that, we came with a plan to have One Health steering mechanism, maybe One Health 2.0, because we say we need to renovate the concept so that everyone feels it belongs to them and not only health sector, and that we have lots of capacity building, and we need to repeat capacity building to everyone, build on what exists, build on the success. And one of the very important things was keep it simple and monitor, show the impact. We need to show impact, and we want people to be on the boat with it. We want people to say, oh, I want to be there. We also need funding mechanism, and funding mechanism that do not invent a new concept every time, but a funding mechanism that builds on success, build on impact, and take it from here, take it from the ground, and repeat, even if it's not disruptive, but we are building blocks, and that was really important. And one of the things was really making sure we have calculation not only on the health impact, but also on the social impact and the economic impact, which is not there. But and one of the solutions would be to have One Health impact assessment in all policy in the EU. So let's keep it simple, build blocks, and convince the president. Thank you.
Thank you. Thank you.
I'll give it to the next.
Yes, you can give me. So now going to alphabetical order, and yes, I can click while I'm holding 3 microphones practically. Track A, for track A we have Clara Del Prete from Crimedim. So there you go.
Thank you. So for track A, we did some reasoning on crisis preparedness and cross-border collaboration. The recommendations we came up with are that here we call it more disaster management, just for the sake of, probably also my background being brought into the conversation. But let's say that there is not really a difference while we are speaking about recommendation between crisis and disaster. They are more operational than other. So the first priority, the first recommendation we drew on was to make disaster management or crisis management a priority at the national, local, and regional level. We suggested that ministries of health need to take into consideration and take advantage of adaptive and experiential learning to make it institutionalized. And to do so, we said that this requires continuous assessment of how we are responding at the local level to disasters and take this lesson learned into practice. We also said that there are a lot of European-funded projects going on at the national level, and we said that usually we struggle to put them into practice at the national level. So one recommendation is to actually link these European projects and European strategies with national ones, to also make them more appealing for policymakers and make them more operational. Third, we suggested something very important, that disaster management, crisis management should be considered as part of the healthcare management agenda. So, so to do so, basically, we recommended the development of plans that are operational, but not only are related to the civil protection according to whatever mechanism there is at the national level, but they are taken as part, like consistent part of health systems. Then we suggested and recommended to improve the professional skill mix of healthcare workforce and to provide mandatory / appealing training for this healthcare workforce. We also recommended to improve communication about disaster management and to make, let's say, disaster preparedness more appealing by showcasing co-benefits of being disaster prepared. So one example that was brought to the table was how in Japan they are preparing school kids through educational programs, and that actually has been showing, really benefits in disaster preparedness and less negative effects of this. Then, lastly, one recommendation was about taking advantage of the golden window of opportunity. So this is a window of opportunity that should be considered and used to ensure policy implementation. Taking advantage of this golden window means knowing when there is two conditions, so high salience and low conflict. Hopefully I'm saying this right. And this means that in given moments, certain situations combine these two conditions. So we have high salience, meaning the problem is active, so people know there is this problem, and low conflict means we can easily act upon it. We also said, and it's not written down, but I think it's very important, that if these two conditions, so the golden window is not open and we cannot take advantage of that, we should prepare with policy readiness. So when we don't have this window of opportunity, we should be working on how we want our policies to be for when that window of opportunity comes. That's everything, I think. Thank you. I'm giving it.
There you go. Thank you. Well, thank you very much, Chiara. And last but not least, sorry, now I need to free myself from one microphone. There we go. Wonderful. We have from track D, Marco Di Donato. Where are you? Here. Who is going to present on the European Health Data Space?
Yeah, good afternoon, everybody. We actually had a very interesting conversation, and I wanted to thank all the group participants and also Alexis for co-moderating with me the session. We split it into groups, so we worked on two, let's say, macro recommendations. One is on governance. As you can see here, we started from the key challenges, which are uneven digital maturity across countries and regions, inconsistent coding practices and low uptake of shared standards and limited awareness of EHDS requirement among IT teams and clinicians. So in terms of what we could do, the idea was to, let's say, create a National Transformation Center to convert primary data sets into EHDS compliant format, but also adopt a bottom-up engagement model involving like a community of practice, feedback loops, and shared tooling, as well as implement target training for hospital IT teams. So it was also like, we also touched upon the topic of education and skills. In terms of who must to be involved in this, of course, technology developers, as well as hospital informatic teams, clinicians, patient groups. So like it was very broad and multi-stakeholder vision we adopted. In terms of resource needed, of course, time came as one of the most needed one, as well as network development, governance support, and maintenance and of interoperability asset. What we would like to achieve is harmonized data structures that enable EU-level analytics in practice, continuity of local clinical workflows, and broader availability of high-quality datasets for research planning and evaluation. That was a bit what emerged from the group that work on governance, and maybe we can go to the next slide. You have it? Yeah, the other one was more on citizen engagement, transparency, and trust. Here we started from the reflection that depending on the context, of course, the level of trust within the health towards the health data system could be a bit low. So how we can strengthen that? Idea, let's say, was first of all to work on communication channels. So to strengthen communication channels toward the citizens, but also healthcare professionals, or create new communication channels where needed to communicate clearly and transparently about especially data use, collection, ownership, and so on and so forth. Then when it comes to let's say the people that must be involved, of course it's the recommendation is targeting, let's say, both the policymakers at different levels, of course, but it's a combination also of dialogue with other stakeholders. So we let's say stress the importance of having the citizens and the professionals, but also the other stakeholders like industry involved in the let's say creation of measures that might help building trust. And we talked about examples also from countries like having representatives from citizens, expert, patient, let's say health data ambassadors among professionals. In terms of the resource needed, of course, communication tool, public dashboard, and other materials that can help also tailor a bit the message and information on the audience we would like to speak. And in terms of expected impact, of course, we have higher willingness to contribute to data sharing and reduce resistance to secondary uses, but also, of course, a stronger, more durable trust in the health data system and a more meaningful ongoing participation by citizens, professionals, but all stakeholders in building public trust in the health data system. So that was a bit what came up from our group. And of course, if any colleagues want to add something.
Thank you, Marco. And this actually gets us to the end of the recommendation that will be the base of the roadmap. I would like to sincerely thank each and every one of you, and of course those who had to leave early because they have to take trains and they have to go to back to their jobs for their time. As I mentioned before, this is the base that will then create the roadmap that we will be happy to send to you. And then, of course, we welcome comments and we welcome your feedback, and we welcome some additional case studies that maybe you didn't have the chance or you didn't want to present here, or that will develop in the next few months, which is when we will be able to prepare the roadmap. But the CARE Summit, of course, was a great opportunity opportunity to bring you all together, but it also wants to be an opportunity for us to commit to these recommendations. And so what I would like to do, more on a symbolic side, is to ask for each and every one of you to commit to these recommendations, of course, within the limits of your work, your practice, but within your organization, within your regions, within your local authorities, wherever you do work, whatever your job is, we hope that you can commit to implementing these recommendations within your possibilities. And to signal this commitment, I'd like to ask you to sign this board in signal of, indeed, commitment. And so I'm happy to do that on behalf of Emma, and I then invite you, there we go, that's me. And I then invite you to take these pens. Can I start with you? There you go. Please, do come up. Niamh, can I start with you? There you go, fantastic. And while we are committing through these signatures, please do stand up and go and sign whenever you feel like it. I would really like to thank each and every one of you for being here. For those of you especially who traveled up until Brussels, I would very much like to thank the team of Emma who has been behind the organization of this event. There has been a lot of work that has been put into these. I hope you enjoyed the discussion. I hope you found it a good opportunity to connect with different people. And I hope you will bring these recommendations with you home. And I hope we will stay connected to make sure that these continues to happen in our everyday. And with this, I thank you again. And as people continue to sign, I wish you a wonderful trip back home, and thanks again for having been with us.